Namaste everyone. I am Dr. Anakha, working as Medical Officer in Vaidyagrama. So I warmly welcome you all to yet another session of Parisharaka. So let us begin today's session with a humble prayer. Om Namami Dhanvantarim Adidevam Surasurervantita Padapatmam Loke Jararubhaya Mrityunasham Dhataramisham Vividhaushadhina. So today we will be exploring the fascinating subject of physiology. So in the Paricharaka, physiology is one of the main important subject that you need to understand in order to practice and perform therapy or Ayurveda Panchakarma in each of the patients. So without any further delay, let us dive into the topic. So physiology, from the name itself, it will be understood that it is something related to the functioning of our body. Yes, so physiology is not just about understanding how the body functions, but about appreciating the intelligence of the human system, like how every cell, tissue and organ works in harmony inside our body. So from an Ayurveda perspective, this becomes even more meaningful as we relate these functions to the balance of doshas, Agni and Dhatu that is present in our body, which I am pretty sure you will be now familiar with all these concepts in Ayurveda. Okay, along with this, we will also try to understand the modern physiological aspects and more importantly, how to make this knowledge practically useful in our day-to-day therapies. For example, whether it is in selecting the right treatment for the patient, about understanding the patient's response towards each treatment, or how we can improve the outcome of each treatment that we are performing on a patient. So overall improvement in your skills as a therapist will also be coming from understanding the physiology of a human body. Okay, now I think let us make this session a little bit more insightful as we connect the modern concepts with the Ayurveda wisdom that I am about to share with you now. Okay, so today we are stepping into the physiology and I want you to approach this not just as another subject to study, but as a lens through which you begin to understand life itself, because physiology is actually happening inside you right now at this very moment. So without a pause, without your permission, actually many things are happening inside our body. As you are sitting and listening to what I am speaking, your heart is actually rhythmically contracting and relaxing, which means that it is pushing blood through thousands of kilometers of vessels that is present inside your body. Okay, your lungs are actually quietly exchanging the gases and like bringing in the oxygen and removing the carbon dioxide that is present in our body. So while I am speaking, all these activities are happening inside your body, inside my body, etc. Okay, at the same time, your digestive system, it is processing whatever you ate earlier today, breaking it down into absorbable nutrients which is necessary for the body's proper functioning. Your brain is receiving, analyzing and responding to every word I am saying. You are not consciously telling any of this organ to function, yet they are working in perfect coordination. That silent, continuous activity is what we call the physiology. Okay, the study of how the human body functions at every level, from the smallest cell to the most complex system. That is what is physiology is all about. So basically we are understanding the functions that is happening inside our body. So now there will be confusions regarding certain things. So let us build a clear distinction regarding the same. You have already studied or you will be going through anatomy soon, which tells what is present in the body, the structure, the organs, the different kind of tissues that is present in your body. Like anatomy answers the question what is there, like what is there in your body. But physiology answers the more important question, what is it doing. Okay, for example, anatomy tells you that the heart has 4 chambers. Okay, our human heart is having 4 chambers, but physiology explains how those chambers are useful for the functioning of the heart, how they are getting filled with the blood, how contraction is happening in a coordinated manner, how it is generating a pressure inside our body, how the circulation is maintained throughout our body. Another example is anatomy tells you that our lungs have alveoli. It is one of the part of the lungs, but physiology actually explains how oxygen diffuses into the blood and how carbon dioxide diffuses out. So if anatomy is like knowing the parts of a machine, physiology is actually understanding how that machine actually runs. Okay, so this understanding becomes extremely important when we move towards a particular disease, because disease conditions or illness that is happening in our body is nothing but an alteration that is happening to the normal functioning of our body. So if you do not know what is normal, you will never be able to recognize what is abnormal. Okay, for example, if you don't understand how blood pressure is normally regulated, you cannot fully understand hypertension or the increased blood pressure levels in your body. For example, if you don't understand the normal digestion that is happening in our body, you cannot understand conditions like hyperacidity or malabsorption that is happening in the digestive system, which is actually leading to further complicated conditions that we are seeing in our day-to-day life. So this is why physiology forms the foundation of all clinical subjects. So it is not something you study once and forget, but it is something that you will keep applying throughout your entire therapy career that is about to begin. Okay, so this is just a basic introduction or an awareness regarding how physiology is actually important in Paricharaka or in understanding the treatment side. So now let us talk about the physiology's origin. Let us talk about the origin of the term physiology, its deeper meaning, and how it connects beautifully with Ayurveda, especially the concept of Kriya Sharira. So Kriya Sharira is the Ayurveda correlated subject of physiology. So when we begin studying the human body, one of the first distinctions we make is between the structure and the function, which I mentioned earlier. So structure is what we see, what we can dissect and observe. This is completely anatomy. But function is what brings the body to life, like how the heart beat, how the food is digested, how thoughts arise, how all this dynamic aspect is studied under physiology. So basically, in simple terms, physiology is the science that explains how the body works. So physiology is the science that explains how the body works. Okay, now physiology, it is the science that explains how the body works. So now if we look at the origin of the word physiology, it actually comes from an ancient Greek word. The word is derived from 2 components, which means physis and logos. Okay, so origin of physiology is into 2 things, which is physis and logos. So this is coming from actually a Greek component. Okay, so the physis, it actually means nature. So physis actually means nature and logos means the study or science. Okay, so physiology literally translates to the study of nature. So in the context of medical science, we can say that the study of natural functions of the living organisms. okay, of the living organism. So this definition itself is very interesting because it shows that physiology is not just about isolated organs but about understanding life as a natural process. So modern physiology, it studies various systems such as the digestive system, circulatory system, respiratory system, nervous system, explaining how each part of this system contributes to maintaining life. It looks at cells, tissues, organs and systems and explain their mechanisms in a detailed and often reductionist manner. Okay. However, if we step back and look at Ayurveda, we realize that the study of function was already established years ago, like thousands of years ago. So Ayurveda did not just separate the body into rigid systems the way modern science does. Then what does Ayurveda do? Which is what we are going to see. Instead, it approached the body through functional principles that govern all these activities. So this is where the concept of Kriya Sharira comes in Ayurveda. Okay. So in Ayurveda, physiology is not just a study of the physical process but a comprehensive understanding of how our life operates at multiple levels. So which are these multiple levels is what you will be thinking now. It can be a physical level, mental level, even subtle level, emotional level. All these levels are getting covered up. Okay. So in Ayurvedic science, the functioning of the body is primarily explained through 4 key concepts, which is dosha, dhatu, mala and agni. So we will be also understanding Kriya Sharira. So Kriya Sharira is the Ayurveda term that we normally says for physiology. Okay. So the primary functioning of the body is explained through the 4 concepts. Okay, so first one is dosha. Second one is the dhatu. Third one is the mala. And fourth one is the agni. Okay, so these are the 4 primary key functioning through which the physiology is happening inside our body. So these 4, dosha, dhatu, mala and agni, they are actually not just any structural entities but they are the dynamic functional units that is happening inside our body. For example, regarding the dosha, we can say that doshas are vata, pitta and kapha. Okay, I am pretty sure you will be familiar with the concept of tridosha, which is vata, pitta and kapha. Okay, so these 3, vata, pitta and kapha, are the fundamental regulators of all physiological activities that is happening inside our body. Okay, so what does each dosha do in our body? I'm pretty sure you will be little familiar about it. Let's just revise and go through the things. So basically, among the 3 doshas, vata is the dosha which governs the movement, communication and nerve impulses that is happening inside our body. When it comes to the pitta is responsible for transformation, digestion and metabolical functions that is happening in our body. At the same time, kapha provides structure, stability and lubrication that is needed for the body to function properly. So instead of describing functions through separate systems, Ayurveda integrates them through these 3 governing principles which are known as the tridoshas. Okay. Similarly, dhatus, the second one, dhatus are the structural and functional tissues that sustain the body. Okay, so these are the structural and functional tissues that sustain the body. They are not just any passive structures, but they are continuously undergoing formation and nourishment inside our body. And the next thing is the mala, which refers to the waste products like the urine, feces and sweat, and their proper elimination is considered essential for maintaining health. Like with all the circulation that is happening inside our body, all the metabolic activities that is happening inside our body, it is a definite thing that our body definitely creates a good amount of waste products. Okay, so these waste products is should be completely eliminated from our body for the proper functioning of our health. So for maintaining good health, eliminating these mala or waste products is important. So mala is all about the eliminating the waste products. Okay. So next it is the Agni, which is one of the most important concepts in Ayurveda, which represent the digestive and metabolic fire. So that is responsible for transforming the food that we are having into energy and tissues. So unlike the modern physiology, where metabolism is often limited to the biochemical reactions, in Ayurveda, when it comes the part of digestion, the Agni actually represents a broader concept that includes digestion, absorption, assimilation and transformation at every level that is in the body. Okay, now we can understand what is Kriya Sharira. So now I believe that you will be having a good idea about what is physiology, what is the concept of physiology, and what is the origin of physiology, and according to Ayurveda, like Kriya Sharira, what are the primary functionings or the components that help the physiology to take a toll on our body. Okay, now we will go a little bit deeper into the Ayurveda aspect of physiology, which means the Kriya Sharira. Okay, so now we will understand what is Kriya Shariram. So Kriya means actually action or function, and Sharira means the body. So Kriya means the function, okay, and Sharira means the body. So Kriya Sharira, it literally means the study of the functions in the body. It is the Ayurveda equivalent of physiology, as I mentioned earlier, but it is much more comprehensive here. So Kriya Sharira, it does only it do not only include the physical process but also the mental functions that is happening in our body as well. It explains how the doshas like the Vata, Pitta and Kapha doshas function in a balanced state. How these dhatu, which is providing the structural and functional tissues, they are acting in our body, how the dhatus are formed and maintained in our body, how Agni regulates metabolism, and how Mala is getting excreted also. It also includes the functioning of the mind or manas, which is considered inseparable from the body in Ayurveda. Okay. So, a little bit few more things about Kriya Sharira. The origin of Kriya Sharira can be traced back to the classical Ayurveda texts like Charaka Samhita, Sushrita Samhita and Ashtanga Hridaya. Among these three Brihatrayas that is happening, Charaka Samhita provides the most detailed insights into the physiology. So it elaborates on how the body functions in health and how imbalances lead to the disease that is happening. Okay, so it explains the role of doshas in maintaining that equilibrium, the importance of Agni in digestion and metabolism, and the continuous process of the tissue nourishment, which is important for the circulation that is happening in our body. Okay, and when it comes to the Sushrita Samhita, Acharya Sushrita have more focused on the surgical aspects, like also provide important physiological concepts, especially related to the circulation and body functions, because based upon the surgical aspect, the functioning is really important. Surgeries are done to remove the pathologies that is happening in our body, and further circulation and functioning is important. So in that basis, Sushrita Samhita has been written. And in Ashtanga Hridaya, it presents this concept in a more concise and clinically applicable manner. Okay, so one of the most fascinating aspect of Ayurveda is how it explains physiological process in a very functional way. Like for example, in modern physiology, digestion is explained through the enzymes, acids, alkaline actions that is happening, pH levels, biochemical reactions and everything. But in Ayurveda, the same process is explained through the concept of Jadaragni, which governs the digestion at the level of stomach and intestines, and Dhatu which governs metabolism at the tissue level. Okay, so in the digestive level and in the tissue level, with simply two concepts, the whole process of physiology in digestive system is being explained. Okay, similarly, circulation is the modern physiology. It is explained through the heart and blood vessels, the pumping and everything. But in Ayurveda, this function is attributed to the Vyana Vata, which is one type of Vata that is present in our body. It is a subtype of Vata. So if we compare the two systems, modern physiology provides a detailed structural and mechanistic explanation, while Ayurveda provides a broader functional and philosophical understanding of the same. Okay, so modern science tells us how things happen, often at a microscopic or molecular level, but Ayurveda tells us why they happen and what maintain their balance. So these two perspectives are not contradictory, but they are complementary. They are complementing each other and they are supporting the whole functioning of our body in a good way. So when we combine them, we get a more complete understanding of the human body. Okay, how can I say one more instance? Like for an instance, when we study a disease condition that is happening in our body, like due to some pathological things that has happened, be it external or internal, the modern physiology helps us understand the pathological changes in the organ levels and in the tissue levels. Okay, so Ayurveda helps us understanding the underlying imbalance in the doshas and the disruption that is happening in the Agni and Dhatu formation. So this dual understanding, be it in the organ tissue level, be it in the Agni, Dhatu, Dosha level, this dual understanding is especially useful in clinical practices, that is especially during the treatments, where we aim not only to treat symptoms but also to restore the balance and prevent the recurrence that is happening in our body. Okay, so to conclude, what we can say is that the term physiology, which originates from the Greek word meaning of study of nature, it represents the study of functions of living beings that is there, and Ayurveda have already developed a comprehensive system of functional understanding through which one? The Kriya Sharira, or the physiology of functional understanding through Kriya Sharira, which includes Dosha, Dhatu, Mala and Agni. Okay, while modern physiology focuses more on the structural and mechanic details, Ayurveda emphasizes the functional balance and holistic health. So by integrating both approaches, we can we can go in depth regarding the understanding and enhance our ability to treat the patients effectively. So the treatments that you are providing to the patient, the depth, the pressure, the intensity in which you are doing, it can be more useful once you get a good understanding of the functioning. So this integration is particularly important in today's world, because where there is a growing need for holistic and patient-centered approaches to the health and diseases that is happening. Okay, so that was all about an introduction to the physiology. Now let's go one step deeper into a very important concept that is present in the modern physiology, which is called as the homeostasis. Okay, so homeostasis, I'm pretty sure it will be a little familiar topic in physiology. So this is one of the most fundamental ideas you must clearly understand. Okay, so what is homeostasis? Homeostasis refers to the ability of the body to maintain a stable internal environment. Okay. So homeostasis, it is one of the most fundamental idea. So what does it explain? It refers to the ability of the body to maintain a stable internal environment even when the external conditions are constantly changing. So whatever things are happening outside or around us, even if it is changing, our body should have this capacity to keep the internal environment safe. Okay, the outside world, it is unpredictable. Temperature can be changing, food availability can be changed, the stress level that we are taking on a daily basis, all these things can get changed. But your body tries to keep its internal condition within a narrow optimal range. So for example, like the parameters like the body temperature, blood pH level, glucose level, the electrolyte balance, all of these are tightly regulated when it comes to the homeostasis. What should I give as an example? Okay, so a simple example, imagine you step out into intense heat. Now it's a summertime and it is very intense heat outside and you are stepping out. The external temperature is rising significantly, but your body cannot allow its internal temperature to rise beyond a certain point, because even a small increase can affect the enzyme activity and cellular function that is happening inside our body. So what does the body do? What does it do? It needs to maintain that temperature, right? So for that, it activates the sweat glands that is present in our body. So it causes sweating. So as sweat evaporates from the skin, it cools the body. At the same time, the blood vessels in the skin start dilating, allowing more heat to be lost. So it is being taken out from our body. Okay. Now consider exact opposite situation. You are exposed to extreme cold. Imagine you went to Antarctica. Okay. Your body responds by constricting these blood vessels. What was dilated is now getting constricted in the skin to reduce the heat loss by initiating shivering, which generates heat through the muscle activity. So all of this is happening automatically in our body without our conscious effort. We are not doing anything for these things to happen, right? This constant adjustment to maintain stability is what is called as homeostasis. Okay, now what is fascinating is that this concept of homeostasis has a very beautiful parallel in Ayurveda. Like it has a parallel thing happening in Ayurveda also. Ayurveda does not use the word homeostasis, but it speaks extensively about this balance, specifically the balance of the Vata, Pitta and Kapha, which are known as the three doshas that in our body. Okay, so but I want you to understand them not as a vague or abstract concept, but as a functional principle that can be directly correlated with the physiological processes that is happening inside our body. Okay, so now let us once again understand what is Vata, what is Pitta and what is Kapha. So Vata, it is responsible for all the movement in the body. When there is a motion, Vata is involved. This includes the movement of nerve impulses, the flow of blood, the expansion and contraction of our lungs whenever we are breathing, the movement of food through the gastrointestinal tract, and even subtle movements like the transport of the molecules across the cell membranes. Okay, so in modern terms, you can relate Vata to the neural activity, the circulation and all forms of dynamic transport that is happening. So if Vata is functioning properly, movements are smooth and coordinated. Okay, so if Vata is disturbed, you may see irregular movements like spasms, dryness or erratic functions that is happening inside our body. So this is what the imbalances of Vata causes to our body. What is next? Next is the Pitta dosha. So Pitta dosha, it is responsible for the transformation that is happening in our body. So wherever something is being converted from one to another, Pitta is at work. So if any kind of transformation is happening, just understand that the Pitta dosha is the one that is acting upon that. And the most obvious example is digestion. Okay, the breakdown of food into smaller molecules. So but it goes actually beyond that. There are more complex functions that is happening in that level, like metabolism is happening at the cellular level, enzyme activity, hormone synthesis, even the processing of information in the brain. All of these involve transformation and can be understood under Pitta. So in modern physiology, you can relate Pitta with the biochemical reactions, enzymatic processes and the metabolic pathways. Okay, so we can prepare a note for that. So we can correlate vata with the neural activity and motions that is happening in our body. At the same time, pitta can be correlated with what all things? We can talk about the biochemical reactions. What else? Biochemical reactions, then enzymatic process, as I was mentioning earlier. So this is the enzymatic processes, and one more thing is happening is metabolic pathways. Okay, so when the pitta is actually, when it is in a balanced state in our body, all these transformations, biochemical reactions, enzymatic processes, the metabolic pathways, all this happens very efficiently in our body. But when it is disturbed, you may see excessive symptoms like heat, first thing, inflammation, or abnormal metabolic activity that can even affect the hormonal levels that is present in our body. Okay, and third one is the kapha. So we had mentioned earlier, kapha is all about the structural things that is happening in our body. Kapha is responsible for structure and stability. Okay, basically it proves the physical framework of the body and maintains the cohesion that is needed. For example, bones, muscles, fat, the connective tissues, all these structural components are supported by the kapha dosha in our body. So what does it provide? It provides lubrication. For example, we are having many kind of joints in our body, and all these joints are having different kind of fluids. So synovial joints and everything. In modern terms, kapha can be correlated with the structural integrity, fluid balance, and anabolic process. So this is the structural integrity, anabolic process that is happening, and one more thing is the lubrication or the fluid action that is happening inside our body. Okay, so when the kapha is balanced, the body is stable and well nourished. But when the kapha is disturbed, there may be excessive heaviness, congestion, or accumulation that is happening. So if you observe carefully, these three doshas together cover all the aspects of physiology, which is movement, transformation, and stability. So this is the very comprehensive way of understanding this body's function. In modern physiology, explains mechanisms in a detailed molecular way, while Ayurveda provides a broader functional perspectives. Okay, so when you combine both, your understanding becomes much deeper and more clinically useful. So throughout this course, I want you to continuously build this bridge between the modern physiology and Ayurveda concepts. Okay, like you should have always, you should think in both the side, the Ayurveda side and in the modern concepts also. For example, when we study the nervous system, think about how vata is involved in the nerve conduction, as we were mentioning about the neural activity. When we study digestion and metabolism, think about how the pitta dosha is acting in each levels. And when we study the body fluids, tissues, immunity and everything, think about the kapha dosha. So this integrated approach will not only help you remember the concept better, but will also make your clinical understanding little bit more stronger. See, which is extremely necessary when you are doing a treatment on a patient, so that the pressure, the way of moving your hands on the body, everything can be much more deeper. Okay, so as we begin the physiology, keep one idea very clear in your mind. The body is not a collection of isolated organs working independently. No, it is a highly coordinated system where every function is interconnected. So, and both modern physiology and Ayurveda, in their own ways, they are trying to explain the same thing or the same truth, that health is nothing but a state of dynamic balance, and a disease, it actually begins when this balance is getting disturbed. Okay. So these are the main things that is happening. So in homeostasis, what were we discussing about the homeostasis? Homeostasis is the body's ability to maintain a stable internal environment even if the external environment continuously changes or brings any kind of disturbances to our body. And what is Vata, Pitta and Kapha doing in these functions? Vata, it can have the neural activity and it helps with the motions. Pitta, it is the biochemical reactions, enzymatic processes and metabolic pathway is in which this one is getting active. And Kapha is the level in which the lubrication or the fluid actions that is happening in our body, the structural integrity that is happening and the anabolic processes that is happening in our body is being understood. Okay, so that was all about homeostasis, which is the very basic concept that is there in physiology. Now let us move into understanding the different systems that is meant in the modern physiology and how we can actually correlate them with the Ayurveda concepts. Okay, so each of this system that I am going to give you a brief now will be detailedly discussed in the upcoming sessions. About each system will be one of the topics that we will be discussing, but just as an introduction, just to give you a brief or an idea about what is happening in the structural things, in the functions that is happening in our body, I just thought of giving you a brief about different systems that is there in our body. Okay, so and actually all these systems that we are talking about, all these systems is interconnected and all these systems altogether works to maintain a good balance in the body and to make the physiology happen even more eventually. Okay. So which are the core different systems that is happening in our body? So in modern science, the human body is divided into various systems such as the nervous system. I think I can write it down. So this is the nervous system. Another one is the cardiovascular system. Another one is the respiratory system, digestive system. Okay. Another one is the endocrine system, which actually deals with all the hormonal things that is happening in our body. So the endocrine system. Next one is the musculoskeletal system. It basically talks about the bones and muscle functions that is happening inside our body. Next, nervous system, cardio, respiratory, digestive, endocrine, muscular. Another one that we have is the urinary system. And last one is the reproductive system. Okay. Okay. So these are the different systems that is present in our body, which are all the nervous system, which talks about the different kind of activities happening in the central nervous system. Cardiovascular system basically talks about the circulation and heart health. Respiratory system focuses on the breathing things and lungs in our body. Digestive system talks about the metabolic activities, the digestion, elimination of the waste materials and everything. Endocrine system focuses on the hormonal things that is happening in our body. Musculoskeletal system talks about the different kind of muscles and bone, its function in our body. Urinary system talks about the function of the kidney and the urethra and different kind of organs that is present in the urinary system. And reproductive system talks about the birth of a baby and how reproduction happens inside a human's body. Okay, so each of these system is having a specific function, as I mentioned, but in reality all these systems are interconnected with each other and they work together to maintain the homeostasis about which we were talking at first. Okay, so Ayurveda also conveys a similar idea, but instead of dividing the body strictly into systems, it explains these functions through dosha, dhatu, agni, shrotas and etc. So which altogether collectively govern all the physiological activities which is being said through all these different systems. Okay, now let us go a little deeper. Like I'll give you a brief about each of the system. So first we can discuss about the nervous system. So nervous system, it includes the brain, spinal cord and nerves. So it is the one that is actually responsible for the control, coordination and communication within the body. And in Ayurveda, this closely correlates with the Vata dosha, which I have been talking from the first, especially with the Prana, Udana and Vyana kind of Vatas that is there in our body. So these actually regulate the sensory perception, the motor activity and higher functions like speech and cognition. Okay, any disturbances in this Vata dosha can actually manifest a neurological issue such as tremor, anxiety, pain disorders, etc. in our body. So this understanding helps us in therapy. For example, using an Abhyanga or Shirodhara treatments with the instruction of the physician can actually help to calm down the Vata, and it will help to stabilize the nervous system activity that is happening inside our body. Okay, next we can talk about the cardiovascular system. The cardiovascular system, which includes the heart and blood vessels, is responsible for the circulation of blood. Not only blood, oxygen and nutrients throughout the body. So basically circulation of blood, oxygen and nutrients throughout the body. In Ayurveda, the circulation is governed by the Vyana Vata, while the blood tissue corresponds to the Rakta Dhatu. The heart or Hridaya is considered as a vital organ and also a seat of consciousness. Okay, so when this Vyana Vata functions properly, the circulation that is happening is efficient. But when it is disturbed, it can lead to issues like poor perfusion or like increased blood pressure level called the hypertension. So all the treatment that we are providing can improve these circulations. Like for example, a Svedana or a sudation therapy, it is having certain herbal formulations. It can be understood through this correlation. Okay, moving on to the respiratory system, the third one we were discussing about, which includes the lungs and airways. Its main function is the gas exchange. Okay, like intake of oxygen, releasing out carbon dioxide and everything, taking in oxygen and eliminating carbon dioxide. Basically this can be correlated with the Pranavata, which governs respiration and life force along with the Avalambara kind of Kapha. Okay, that is another kind of Kapha. So which provides a structural support and lubrication to the lungs. So Kapha and Pitta is, Kapha and the respiratory system is having a connection. Okay, when Kapha accumulates, it can lead to congestion, and when Vata is disturbed, breathing becomes irregular. So this is why treatments like the steam inhalation, Nasyam or breathing exercises are effective in managing the different kind of respiratory conditions. Okay, this is just a very brief idea about how this different systems is getting functioned due to the different kind of doshas and dhatus in our body. Okay, next one is the digestive system. It is one of the most important system in physiology or in our body. It involves organs like the stomach, intestines, liver, pancreas, and its primary role is basically, we all will be familiar, digestion, absorption and assimilation of nutrients. Okay, so these are the basic functions. In Ayurveda, this is governed by whom? Agni, especially Jadaragni, about which we were discussing, and there is one more Pitta combination, Pachaka Pitta. So Pachaka Pitta and Jadaragni causes a balanced Agni, and it causes proper digestion and nourishment of the dhatus, while this impaired Agni leads to the formation of Ama. Ama is also known as indigestion, which is the root cause of many diseases. So this is why so much importance is given to the diet, timing of food, and digestive therapies like Deepanam and Pachana. Okay, these are two digestive therapies that we normally mention. It can be done with medications actually. The endocrine system, which is the next one, consists of glands like thyroid gland, pituitary gland, adrenal glands, and all these things regulate hormones and maintain the internal balance of our body. Okay. In Ayurveda, is there any direct structural equivalent? No. But its functions can be understood through the coordinated action of doshas and Agni, especially Pitta, because which governs the metabolism and transformation as we were discussing. So hormonal imbalance can often be seen as a disturbances in the Pitta dosha and the dhatu that is present in our body. and treatment focuses on restoring all these systemic balances rather than targeting a single gland will be more effective. Okay, next one is the musculoskeletal system. It includes, as I mentioned earlier, bones, muscles and joints, providing structure and movement. So in Ayurveda, these bonds actually correspond to the Asti Dhatu, muscle corresponds to the Mamsa Dhatu, and lubrication of all these joints is done by a type of Kabha known as the Shleshaka Kabha. So movement is governed by Vata dosha. So when Vata increases, it can lead to joint pain, stiffness or degeneration, while Kapha imbalances can actually causes different kind of heaviness, and it will also affect the mobility of the body. Okay, so there comes the importance of treatments like Abhyangam, Pindasvetam, different vastis, because they directly address the Vata and improve different kind of tissue nourishments. Okay, and regarding the next system, it is the urinary system. So urinary system, which includes the kidney, ureters, bladder, urethra, etc., is responsible for the filtration and elimination of the waste fluids that is present in our body, the fluid things. Okay, so in Ayurveda, this function is associated with the different shrotas known as the Mutravaha shrotas, and it is regulated by dosha. Which one? There is a movement happening, so it will be related to Vata. So movement of Vata and structural integrity is important, so Kabha will be also included. So proper elimination is essential for maintaining the internal balance and disturbances. Maintaining the internal balance, and if any disturbances happens, it can lead to the retention or excessive urination. So treatment focuses on maintaining proper flow and cleansing all these channels through which this is happening. Okay, and last one is the reproductive system. Reproductive system, we all know it is responsible for the reproduction and continuation of life. So in Ayurveda, this is governed by the dhatu known as the Shukra dhatu in males and Artava dhatu in the females. Okay, it represents the most refined form of tissue and is closely linked with the overall vitality and immunity that is present in our body. So balanced doshas, proper dhatu nourishment is really essential for a healthy reproductive function. And certain therapies like Rasayanam, Vajikaranam are also included to strengthen this particular reproductive system in the male and female human bodies. Okay, so now when we look at the modern physiology and Ayurveda physiology together, what we understand? We understand that modern science gives us a structural clarity and measurable parameters, while Ayurveda provides a functional and holistic understanding. So as therapists and practitioners, our role is to integrate both using the modern knowledge to assess and Ayurveda to treat the root cause by restoring a good balance. So this integrated approach makes our treatments and personalized care for the patients very more effective and meaningful. Okay, so I think with this we can wind up today's session about physiology. So just for brushing up, we can say we discussed what is physiology, the impact of physiology in modern science and in Ayurveda, the origin of the term physiology, what are the different primary components that is present in Ayurveda that can actually help with the physiology functioning that is happening. And then we discussed about what is Kriya Shariram, the word derival we discussed, and we discussed the role of Vata, Pitta and Kapha and its functioning, its aggravation and decretion and everything that can causes different kind of pathological issues in our body. And finally, we discussed about the different systems that is present in physiology. So these different systems like nervous system, cardiovascular, respiratory, digestive, endocrine, musculoskeletal, urinary and reproductive. These different systems will be discussed, and we can have a beautiful session on all these systems individually. We will be discussing all these systems even more deeply regarding how each of this system is functioning in our body, how it is causing a pathology, how it is maintaining the health in a human body. Okay, so I'll see you on the next class with a little bit more innovative topic on physiology. Thank you.